See Charlie and his 3D printed implant back in about 3 months' time. In the meantime, anything else I can help you with? How are the cats, Biggs and Luna?
Yeah, actually, I meant to talk to you about Luna at the beginning. Can I buy 5 more minutes?
Yep, that should be fine.
Brilliant. I've made a bit of a mistake with Luna. I bought one of those gene screens for her, and I thought it'd be really fun to, learn about her ancestors and maybe find out her favourite food. But it shows she's got a really high risk of skin cancer, and I don't really know what to do about that.
Gosh, that sounds really distressing. Can I have a look at the report you've got? Would you mind just tapping it on the side here for me? Sure. Brilliant. Now I'm just going to let our system have a look at that report, and while I'm doing that, let me just get Luna's file up. Right, okay, I can see she's 2 years old, fully vaccinated, up to date with flea and worm treatment. Oh, she's an outdoor cat. That's quite novel nowadays.
Well, yeah, we're old-fashioned types, and she doesn't seem to enjoy it very much. She doesn't go out as often as I'd expected, but she does go in the garden sometimes.
Well, it's okay. It's not for all cats. Now, before I have a look at the report, I just want to ask a couple of questions to see how she's doing at the moment. So, is she eating and drinking normally? Mm-hmm. Yep. Any recent illnesses?
No, none.
No. Okay. Great. And so, what food is she on at the moment?
Oh, she's on one of the Mars ones, Untitled. But we're thinking about doing a personalised diet now we've got the gene screen.
Yeah, I've seen that work well for some clients. Okay, and finally, have you seen any problems with her ears, nose, mouth, anything like that?
No, nothing.
No, that's fine. Okay, I think the system's finished looking at that. Let me have a look. So, I wouldn't have guessed she had Persian in her, given that, but that's great. Aha, I think this is the chart you're looking at, right? So if we have a look here, we've got 5 reported biomarkers for squamous cell carcinoma. And we've got, out of these, you can see that we've got bars that are green for low risk and red for higher risk. And she's got 4 out of 5 that are high, and 4 out of 5 in the red is enough to worry anyone.
It certainly worried us.
But, I mean, let's put this in perspective. So, squamous cell carcinoma is a type of skin cancer, and 1 in 5 cats in the UK are likely to develop squamous cell carcinoma at some point in their lives, usually at about 12 years of age. But our system has also looked at the fact that it's looked at Luna's appearance and mapped that risk profile onto what we can see. And actually, we know this form of skin cancer is often develops in response to UV exposure, so sunburn, often on white skin, and it often starts on the ears, and we can see that Luna's got black ears. So already the system has lowered her risk profile a bit.
Just a bit. Isn't there anything else we can do?
Sure there is. And actually, what we can do is we can think about it in 3 different ways. We can monitor her better for progress of disease. We can think about treating her better if she gets it. And we can think about preventing it, so lowering the risk that she ever develops it in the first place.
Okay.
So let's think about monitoring. Now, are you able to send the practice system a photo of Luna potentially every 3 to 4 weeks of her face?
Sure.
Is that something brilliant? Actually, alternatively, does she have an Instagram profile?
She does, yes.
Brilliant. So if you send me the handle, I can put that straight into the practice system, and it will keep monitoring to look for any changes in her face. So if you can get, especially pictures are good, but any video, so eating, drinking, meowing, that'll help the system to map how things change. Does that work?
Yeah, that's fine. I was just thinking it's pretty much all videos of her meowing.
That's perfect.
Okay.
Now, actually, one thing, a lot of insurers of higher risk cats actually mandate this service, so it may well be that they cover the cost, but even if they don't, we're only talking about a couple of pounds a month just to make sure that we keep an eye on what's going on.
Okay.
So that's sort of how we can keep an eye on things. But, even if she does develop it, and we don't know whether she will, we can actually treat her better. So we can look at her genetics and any genetics of a cancer that develops to then think about how we treat better.
I'm not happy with talking about treatment. I mean, she's not even ill. She's only 2.
You're absolutely right, and that's kind of the point. She's not sick. She's a healthy little cat. But what we want to do is prolong that period of health as long as possible. And so when we're thinking about how to prevent this disease, we've got a couple of options for things that we can do. Firstly, there are the general cancer risks, so make sure that you keep her weight low, and make sure that if you or your partner smoke, do that away from Luna.
Okay.
And secondly, there are the risks that are specific to this sort of cancer. So I mentioned that one of the things that can affect the development of this tumour is actually sunburn. And you told me that you weren't sure that Luna particularly wanted to be an outdoor cat, right?
Right.
And just like in people, if you stay inside all of the time, your risks of getting skin cancer are substantially lower.
Yeah, I mean, we're kind of set on this rural outdoor cat thing. Isn't there anything else we can do?
Sure, so there are some other things to do. One thing you could do if you still want to let her go out is actually put sunscreen on the areas of her body that are likely to get exposed to the sun.
Oh, like on her ears and her face, and she's going to hate me for that. And there'll be sunscreen on, you know, she does the head thing, and there'll be sunscreen all over my ankles, and I wish I hadn't said anything, really.
It's really hard, and we know that it can be really hard to work out how much intervention you want to do to lower a risk of something that may or may not even happen in the future. But what I can do is, you could have a look, you could set up your smartphone to send you reminders on days when the UV is really high, and then because the effects of the sunlight are cumulative, just applying it every so often when it's really bad, it'll reduce the amount that you need to do.
Yeah, we could do that.
And I've also got some information on how to train cats to have topical medication applied, and that's something as well that I can share with you if that would be helpful.
That'd be really good. Yeah, thank you very much.
And we know that it can be really, really distressing to receive an unexpected genetic diagnosis, and so we actually offer a service to help you with this. You mentioned that your wife's really stressed, and actually what we do is we offer 15-minute genetic counselling teleconsults, and so anyone in the family can have a chat with us to understand what this sort of genetic diagnosis really means. I've got a leaflet on this service. Would that be useful to you?
Thank you.
I'll give you one on the way out.
Thank you very much.
So I think that is everything, and good to see you today. Take care, and bye-bye, Charlie.
Thanks very much.
One moment. About time you got here.
I'm sorry, I came as fast as I could. The evidence and the announcement of your Milk Buyer Association bringing in these screening tests only came out yesterday. But at our practice, as you know, we're very keen on helping you so that your profits in turn feed our commission. So thank you for seeing me.
Straight talking. I knew you liked you. Right, let's come into the office.
Thank you.
Do you fancy coffee?
Thank you.
Right, coffee.
Thank you.
Okay, so details. Why do you want to talk to me today?
Well, as I'm sure you've seen, your Milk Buying Association has just brought in a screen for BMMFs, you know, bovine meat and milk factors. Let me run out through what they are. Discovered in the late 20-teens, small circular contagious pieces of DNA. They accumulate in cattle, and in times of stress, the cattle can start shedding them into the milk, which is why they show up in your bulk tank and why your buyer is about to start screening for them. If that milk is then drunk by a human or used in dairy products, the human decades later can go on to have a much higher risk of breast cancer. There's a similar problem with BMMFs in beef, but that's why your buyer's interested.
Huh, so somewhere between a plasmid and a transforming retrovirus?
I couldn't have said it better myself.
My postdoc was in immunology. So, right, if my cows have these things, what are we going to do?
Well, currently there's no cure, unfortunately. There may be one eventually. There are some interesting things going on in interference RNA. But at the moment, there's a short, medium, and long-term plan. The short term, I'm sure you're not going to like, but I'll walk you through. It is to dump milk. I know it's the last line, and I'm very sorry about that. We can minimize the amount of milk that gets wasted, and we will do that. And you'll see that this is really only a short-term thing. I assume you've got inline analyzers?
Yeah, absolutely. I can get the robots to collect samples for you at milking if you pick them up. Is that going to, if you run them, is that going to go straight into my management software?
Oh, certainly. If we didn't have a connection to your management software, a lot of alarms would go off at the practice. Yes, so I'll get those analyzed. We'll do a qPCR and see which animals are shedding the most. That then means you can dump the bare minimum of milk. You get the highest yield of the highest quality milk. But, as I said, there really is only a short-term thing. We're not into dumping milk. Your yield is, well, it's our yield to a first approximation. In the medium term, though, there are more things we can do. Mm-hmm. I mentioned that these things are shed more at times of stress, and that includes times of acute comorbidity. So we're going to need to look at your on-farm data and combine that with the genetic data. We've already got the genetics for your herd to try and work out which animals are most likely to be suffering an illness and link that to their shedding. It's kind of a predict and prevent attack. I see that your cattle are wearing collars. I assume that's, oh crikey. I assume that's the RFID for the milking robots?
Yep, that's true.
Those have got sensors on them, don't they?
Yeah, so they've got pedometers, accelerometers, and thermometers. I have to say that the wireless charger is still in the box, but I could probably have those up and running within the next 48 hours.
Perfect. If you could, that would be very useful. The movement of the animals, their number of steps, their amount of time lying down, sleeping, ruminating, combined with their skin temperature, looking for transient pyrexia, or really cluing us into their hormonal state will be hugely important. That data pool, combined with the hereditary data that we've already got, should show us not only which diseases on farm, and I hate to say that there are some illnesses going on in farm, there always are, which illnesses are linked to shedding, which animals are about to start shedding, so that we can A, personalize their feed ration, micronutrients and macronutrients, and know if we ever have to start dumping milk again. Probably not. Mm-hmm. And then in the longer term, there are some more powerful things we can do. I note your background in immunology. You're used to running a lab. The guys at the practice and I agree that one of the options for you might be to run a high biosecurity farm. Have you considered buying ultra-clean milk replacer and breeding all animals on site?
I guess if it's needed, we can look into what that might entail.
It would be a lot of work. The only reason I raise it is because of what we know about you. The other thing, though, in that is that there's always a risk of these BMMFs showing up on farm, and if we do find some in your screens today and tomorrow, let's not worry about that option. But if we don't, that is a possible option.
I remember seeing that RCVS Knowledge was running some form of Sentinel program.
Certainly true. Well, yes, they will be very useful to showing us which BMMFs are moving across the country, which other diseases are spreading, which types of biosecurity measures are going to be most effective. If we were to donate our data to them, they would anonymize it, but in so doing, the value they give us in return is access to the Sentinel system. It's well worth considering. Finally, the other thing we need to do is look at the market as it is at the moment. Increasing public awareness of BMMFs is leading more and more people to think about non-cattle dairy products. Sure, sheep and goat, but also non-cattle bovine species.
Non-cattle, like bovine species? I don't even know what that means.
Sorry, things like buffalo and zebu.
Huh. Zebu, they're the ones with the kind of floppy ears, aren't they?
And the big hump.
They probably cope with the hot temperatures we're having nowadays.
It certainly would.
Okay. All right. Okay. So I think I'm seeing a little bit of way forward. Can you just tell me what those three parts were, really quick?
Sure, certainly. In the very short term, we're looking at dumping milk. We'll be absolutely scrupulous and make sure that we judge the concentration of BMMFs from each cow and dump the minimum milk required.
Okay.
That's a short-term stopgap. That buys you time to implement the other actions, which are to predict and personalize the treatment of the cattle, to work out which ones are about to start shedding and to treat them accordingly. Uh-huh. And in the very long term, we want to think about personalizing your farm for you and for the market around you, and moving potentially away from cows.
Great. Okay. Have you finished your coffee?
I have.
Let's get started.
Certainly.
Did you want to wrap up?
Oh, I do want to wrap up. I'm sorry. You're absolutely right. If I didn't have Gwen to nudge me, we would not get anywhere. We've done our best to incorporate the various things we've learned throughout the day, the various bits of personal and precision medicine into those visions. Clearly, those are not the future, but they may give us some flavour of where we could be heading. I'd like to hand back over to Anthony and Chris now.